Welcome to Early Care Connection. I'm Izzy Greenberg. Today we are joined by our resident panel of experts, Meryl Gay from the Connecticut Early Childhood Alliance and Ava Bermudez Zimmerman from Child Care for CT. I'll start by thanking Lucille, our interpreter, for helping us this morning and opening these conversations up to so many more people. Of course, though, the biggest gratitude goes out to our community of hundreds of caregivers, providers, and advocates who show up every Monday. Welcome. We're glad to be here with you. Okay, so you guys can use the chat for conversation with each other or technical difficulties, but please use the Q&A for questions for the panelists. We are going to get right into it. We've got a number of topics to discuss this morning. So we're joined this morning by some folks from the UCONN School of Social Work to discuss their parent caregiver survey. So I'm going to welcome Veronica Hannah Walker, Antonia Caba, and Samantha Lawrence from UCONN, and just going to turn it right over to you guys. Welcome, glad you're here, and you can go ahead and share away.
Perfect, thank you. Can you guys see the slides?
Yes.
Perfect. So hello, I'm Veronica Hannah Walker, and as Izzy said, I'm with the UCONN School of Social Work, and I'm here today to talk about the Parent Caregiver Survey. So what is this Parent Caregiver Survey? So the UCONN School of Social Work is partnering with the Office of Early Childhood, or OEC, to reach Connecticut families, parents and caregivers with children between the ages of 0 to 5. This survey is administered virtually and in person, and it started September 1st, and it's going to end November 23rd. And our survey asks about families' needs for childcare, their experiences with early childhood services, families' priorities for childcare, and any barriers to accessing childcare. The survey is about 6 to 15 minutes long, and parents who take it virtually are entered into a raffle for one of many $100 gift cards. And the first 300 parents that take it with us in person, they receive a $30 gift card to thank them for their time. And then the first 150 parents who take the survey with home visitors, Sparkler community engagement specialists, and family bridge nurses and community health workers, they receive a $30 gift card. And the surveys and recruitment materials such as flyers are available in English, Spanish, Polish, and Portuguese to make it as accessible as possible. So how are we reaching parents? So we have been partnering with childcare providers to reach their families. And actually the first 200 providers who share this survey with their families as a thank you for their time, they receive a $20 gift card. We're also partnering, as I mentioned earlier, with home visitors, Sparkler community engagement specialists, and family bridge nurses and community health workers, as these individuals, they have these intimate connections with and have families that they meet with frequently. And so when they give out that survey, they're compensated for their time as well. We also have been emailing parents directly with a survey link or QR code. We have targeted ads on Facebook reaching Connecticut parents. We're also mailing out flyers to our partners to post in their buildings or to hand out to parents that are interested. We also have many amazing parent volunteers that are distributing flyers and survey information within their own networks. And we've also been going the UCONN School of Social Work team, partnering with OEC individuals and parent volunteers. We've been going to numerous in-person events, such as fairs, festivals, college events, community baby showers, library events. And just really quick, here's a snapshot of recruitment. This is a little old, so just to give you some updated numbers, we have had 1,771 as of last week parents and caregivers take the survey. And to give you that regional breakdown, the updated numbers, in Region 1, we have 228 parents. In Region 2, we have 177. In Region 3, we have 445. Region 4, we have 373. Region 5, 252. And Region 6, 241. And we're really excited about these numbers. And to explain this snapshot of Connecticut, so the different gradients in the colors of blue, the deeper shades of blue show the higher concentration of parents with children between 0 and 5. And then you'll see the different shapes, like the yellow square or the green triangle, that shows the different types of outreach that we've been engaging in and showing where that has been throughout the state. And just a reminder, this is about 2 weeks old. We've had more outreach efforts. We've been reaching out to a lot of childcare providers throughout the state to have their parents take the survey in person. And so we're really excited about these efforts, and we couldn't do it without our partners. But we just wanted to give you a small snapshot of the recruitment that's been going on. And so we would love your help if possible. So what are some different ways that you guys could help if possible? So if you're eligible, we would love it if you took the survey yourself. If you are a parent or a primary caregiver of a child between ages 0 and 5, we'd love it if you took the survey. Another way is you could share printed or digital flyers with families. And please feel free to email us at childcarestudy2025@gmail.com if you'd like flyers mailed to you. We can definitely mail you physical flyers. You could also direct parents that you know to the parent caregiver survey page on the OEC website. And my amazing colleagues have been putting all these links in the chat for you if you're interested. And then just a little reminder, if anyone here on the call is a childcare provider, if you share this survey with your families, please make sure that you take the survey that will also be in the chat to receive a $20 gift card as a thank you. And that's the end of the presentation, to give you just some more information about the parent caregiver survey, what we've been doing, and how, if you're interested or available, you could help. And so thank you so much for your guys' time.
Thank you. We actually, if you guys could put the, you have been putting the links into the Q&A, which is amazing. Can you also move them to the chat? Because then that will show up on the recording more easily. Perfect. Okay, well, you were so good at answering the questions in the Q&A that I don't see any questions. Folks, if you have any questions, now is the time to give them to us. Meryl or Ava, do you have any questions? I will say if people want to look at the Q&A, this is for all parents with a child under 6. The type of childcare that family is utilizing, it does not matter for these purposes. The links for the flyer are, let's see, in the chat now. Amazing. That is in English, Spanish, Polish, Portuguese. And I think, is that it? Oh, here. Have you shared the survey with the child and adolescent psychiatry outpatient clinic at UCONN Health in Southington and West Hartford?
That is a great question, Joanne. And Sam and Antonia, correct me if I'm wrong. I know we've sent this out like in a newsletter to all of like UCONN campuses, but I don't believe we specifically have shared it with the child and adolescent psychiatry outpatient clinic in those areas. So that is a fantastic idea.
Great. And then somebody was wondering, is this the same link that was emailed out?
So like in like an ECE email?
Probably. I don't know. Well, maybe you could just tell people where you've emailed it and they can look there.
So we have emailed it to numerous providers. We've emailed it to numerous of our partners. So potentially to specify, if it's a link to a survey, like that says like, oh, please families take it. That's the one for families and primary caregivers with children under 6. So that's one, maybe if you're referring to that, then that's definitely the one that
Great.
that's been emailed out.
Great. Okay, I think that is everything. I did just share the links were in the chat to me. Somebody they were only shared for panelists, which is a very easy and common mistake our panelists make. And so they now are shared in the chat to everyone. And then what will happen, maybe you could go over live, what will happen to the data from this survey?
Yeah, that's a great question. Antonia, Sam, please jump in. My understanding is that with these findings, we're going to write a report up for OEC and for different local governance partners throughout Connecticut. And so they hope to use these results at that local level to truly understand the needs of the parents, not just throughout Connecticut, but the needs of the parents that these local governance partners serve, to see how they could improve programs and childcares in their area.
Great. Let's see. No, we had a hand up, but no. Okay, great. All right, Ava, Meryl, last chance on questions. Oh, wait, there's a couple new ones here. Will the data from this survey be cross-referenced with the 8 rapid surveys currently being completed? The target audience and many of the topics seem to be the same.
I believe my colleague Sam is typing an answer to that. Sam, would you like to jump in?
Do you want me to? I don't mind jumping in.
No, please, yeah.
This is a great question. So yes, those rapid surveys do have some content overlap for sure. We are in contact with the folks who are administering those surveys. We don't, as of yet, have a plan for cross-referencing, but that is something that we will definitely be thinking about at the analysis phase of this. That's a great question.
Okay. Yeah, if parents are seeing both and it feels redundant, I wonder if it will change the uptake of either of them. That's a good point. Thanks, Joanne, for that. And good to know that you guys are gonna, yeah, I think working together would be nice. Okay, now it's last call. Meryl or Ava, does either of you have anything else before we wrap this part up? Okay. All right, well, thank you to our friends at UCONN for being here and helping us understand this morning.
Thank you.
Have a wonderful day, you guys. Okay, let's see. Our next guest is Maggie Adair from the Office of Early Childhood, who wants to talk about care for kids. So Maggie, I don't know if you're ready to join us. And if not, yeah. Hold on, she's joining. All right, Maggie, we're not hearing. Oh, there you are. Perfect.
Morning. Sorry, I was just
No
listening.
problem. That came up quicker than probably you expected it to. So
I was listening actually to the Caregiver survey, which we're very excited about because it's going to provide us with a lot of great data. So we want to thank all the providers who have participated and helped so much with this survey. So a little casual this morning on my Monday morning. I wasn't expecting to go on, but I was in a meeting this morning. About Care for Kids, and we were going through the data to really analyze how much funding we have. Previously, we said we have enough funds in the Care for Kids program through the end of December. The good news is that we can share that conservatively, we think we know we have funds that can last for the end of January. So I thought that it's just really important for the field to know this so people aren't panicking, that we are given allotments, so we already have these funds. So we have sufficient funds, at least through the end of January. That's where our data is showing us. So gives us a little bit of reprieve for our children, our families, and our providers. So I just wanted to share that. We're continuing to, stay within our available appropriations, which is, was a high, we try to be an average, and so right now it's bumped down from the summer because of that happens every time because of after school care, and then it'll probably bump up a little bit, but we are working to stay within available appropriations and also to make sure that we can keep this open as long as possible if should the federal shutdown continue to last. So that's my news, and it's just a little more positive than it was a week ago when we were saying the end of December.
Yeah, no, that's great. And do you know, Maggie, what the current wait list number is?
It's 4,000.
Okay.
It's a lot. It's a lot of families.
It's a lot.
Yeah,
Yep.
it's a lot.
Okay.
It's a lot. But we
that's
want
great news.
we really want to emphasize that the wait list is not due to delays. It is not due to delays in processing. It is due to needing to stay within our available appropriations. So that's why we call it an enrollment management list, because we're trying to manage enrollment to stay within our available state and federal appropriations. It is not due to delays, and I think that gets a little misunderstood. It's we understand that this is a lot of families, which shows the demand for the need for child care in Connecticut and the increasing demand because people are working and they need care for their children. So it's an extremely important program for Connecticut. Along with Early Start Connecticut, along with Smart Start, along with Head Start, it's all important as we know. But Care for Kids goes through every community in the state. So that's where it is a subsidy system.
And when you say, yeah, no, thank you for that news. I think understanding that there's a little bit of more cushion than people may have expected is a good thing. And when you say waitlist or enrollment management, it's really like there's this much money, there's this many people who need it, and you have to have that in balance. It can't.
It has to balance, and
right.
And enrollment goes way up in the summer, right? As much as and then it comes down because of summer camp leaving, after school care. Summer care. And then it just we manage it within that.
There's just right now more families who need care than there is money to pay for that care.
Exactly.
Yeah. Right. Okay. Thank you so much, Maggie.
Thank you.
Sorry for surprising you.
Okay, don't worry. I know. I called Meryl this morning right after the meeting saying this is important news that we should get this out as soon as possible to make sure that people have as much of an understanding as possible. So a whole different month from our reports from last week. So
yeah, there may be a question here for you. Allison, did you have a question for Maggie? The hand raise is always a little tricky. Nope, hand down.
Okay.
Okay, thanks so much.
Thank you.
Okay, and all right, we're all set on that. Care for Kids update. Meryl, I'm going to turn it over to you for some other stuff. Oh, you're muted.
Yeah. So SNAP benefits ended November 1st, which was Saturday. A judge has ruled that the administration needs to use the contingency fund that they have available to continue those SNAP benefits. We're not quite sure when that will take effect. But if you or your staff or your families are experiencing hunger, call 211. They can connect you with the resources that are available. If you're in a larger town, you may want to check with the town to see if they have any kind of food bank or something that might be helpful for families who are experiencing hunger issues. We hope that within the next few days, the available contingency funds will go out to families on their EBT cards, but we are unsure of when exactly that's going to happen. And they have about $5 billion on hand, and I think it's about $9 billion a month. So it's probably enough to fund half a month's worth of, roughly. So we'll see how that all plays out. Folks may have started to receive their premium renewal notices if you are purchasing healthcare through Access Healthcare. We know, family child care providers are self-employed, that, there are other providers who are using Access Healthcare to get care. If you have gotten a big increase in your premiums, and you're willing to share that story, please drop me an email. And when we have press looking for people who've experienced big premium increases, we'd like to have a few names of people to refer them to.
There is a question here, by the way, and
Yep.
this is a holdover from last week about CACFP, the Child and Adult Care Food Program. We did hear back from Congresswoman DeLauro's staff person. I'll just read it to you. I checked with our appropriations team, and we have not heard of any issues or impacts to CACFP. Please let us know if you experience any problems on the ground. So I guess they're not expecting any delays or changes in that. And that's the best we have right now. I don't know, Meryl, if you have any other information.
I played phone tag with someone at the State Department of Ed, but my guess is that they have enough money on hand to cover things for a while.
Okay, great. Also, Verna shared ctfoodshare.org, which I have put in the chat. And Maggie, there was just a clarifying question. You don't have to, you can put it in the chat if you want,
Yeah.
but the question was, is it 4,000 children or 4,000 families on the wait list?
I can put that in the chat. I do want to say that just announced that Congressman Blumenthal and the governor and the AGs and the Attorney General, as well as OEC Commissioner Elena Trueworthy, and then Karen Pascal from our office, the Head Start State Collaboration Office, will be speaking at a press conference at Hands on Hartford at 10 a.m. And it is now covered by CTN. That just came online about 3 minutes ago.
Okay,
so,
great.
And I know that Congresswoman Rosa DeLauro and Mayor Eichler are also speaking this morning in New Haven about the same issue. So there's a lot going on around the state and a lot of attention to this very, very important issue.
Yeah, thanks so much for that, Maggie. All right, and you'll put that in the chat, you said.
Yeah,
okay.
I want to clarify with,
yes,
pretty sure
fine, thank you.
I'm pretty sure.
Meryl, I think this question's for you. When will providers have an opportunity for their employees to participate in the health insurance subsidy program that will be available through endowment funds? Thank you. You're muted, maybe.
OEC and the insurance department are trying to figure out how that will be administered, but that would be for next year's open enrollment. So fall of 2026. So not this year.
Thank you. Also, I'm going to ask about, because it's been in the news so much over the weekend, can you, in case folks weren't here last week when I know we talked about this, can you also just give people an update on Head Start, what the impact to Connecticut will be?
So there are 2 Head Start programs that had November 1st contract renewals. So they are impacted by this, but other arrangements to provide some bridge financing have been made so that there won't be any interruption of service for those 2 programs. We do not have any December renewals, but we do have several with January start dates. So hopefully this shutdown will be resolved before the end of the year, and we will not have to deal with that additional challenge.
Great, thank you. And appreciate that. And Maggie also just reported out, it's 4,000 children on the Care for Kids enrollment management list. And I appreciate that enrollment management list clarification. It's going to be a long time, I suspect, before this whole community stops saying wait list, but we know what you mean. and I know why you're saying it. So
we understand. And also I will add too, I think you may have added already, Meryl, about WIC, Women and Children's Family Program for young mothers with and parents with young children, that is remaining open until the end of November as well.
Okay, great. And also I'm looking right now for the CTN. Meryl, I don't know. Well, actually, Maggie, can you put the link?
Of course, I'll put that in the link. I just put it into our shared it with all of our staff too. I'll just send it right over.
Perfect. If you could put that in the chat. And then Ava, go ahead. Ava, your hand's up, but you are muted.
Here we go. I just put a link into the chat from the Connecticut project with the, there's like a SNAP a SNAP emergency toolkit that they have. We invited them to come on, so we're just coordinating to see if they can come on next Monday before our main speaker to review that toolkit. But I did wanted to share it immediately because of the circumstances that we're all in, so people can take a look at it and just know that we'll do a quick review hopefully next Monday.
Sounds good. And then the CTN player is in there. Okay. Meryl, did you have anything else that you wanted to go over this morning?
Nope.
Can I just add though, on
course.
CTN this morning, at the LOB at 10:30, there's going to be an informational forum before the Appropriations Committee about changes to federal nutrition programs. And it includes the SDE Commissioner, DPH Commissioner, DOAG Commissioner, that's Department of Agriculture, and the Aging and Disabilities Commissioner, and their staff will be presenting. Obviously, we all probably don't have time to watch it at 10:30, but as you know, it's recorded. So if you're interested in finding out about any changes to those programs, you can watch it later on in the day or tomorrow.
Great, thank you. There's also a question here. What about early start slots? And I think, is the RFP supposed to be coming out soon for maybe a January 1 start? I mean, any update there?
I think I can speak for the ECE team. The RFA, it's not an RFP, it's an RFA.
Thank you.
Is expected to be out soon with the anticipated contract award date of January, although that is a tight schedule, as we know, but that is the goal.
Okay, and do you know how many slots that'll be for?
I can't speak to that. If there's someone on our ECE team on this call and can put that in the chat, but I can't answer that.
So
Okay, great. Thank you.
I'll pipe in that there's $10 million available for it. That's about the same amount as the last time around. So roughly 1,000 slots, but it depends on the.
It depends exactly. It may not be at that.
Yeah.
It's in that range, but it depends on who's going to want full day care, school day care, lots of variables.
Yeah. And I can see also.
Oh, and infant toddler care versus preschool care too. Yeah.
Right. And yeah, Yanni Bell asked in the chat, I think that's when will the application be out? I think it's just soon. It's kind of like any minute. So everybody should be looking out for it. I would guess that it will be shared out in lots of different ways. And when it's out, we will let you know that as well.
As you know, there's many steps to getting an RFA out. So it's not that we're delaying it. It's just you got to get things approved pre-auth. So it takes time.
Meryl, probably you, any update on the special legislative session and what their focus will be, any education bills be called?
The special session is scheduled for the 12th and 13th, I think, of November. There has been some talk of movement on a housing bill. I don't know whether they will get to a deal. And the primary thing they have to do is figure out how much of the surplus is going to get put into a fund to deal with federal cuts as opposed to being used to pay off pension debt. I don't believe that there will be much more. I have not heard about an education bill being part of this.
I also haven't heard that, but yes, thank you. Okay, I think that's it for this morning, everyone. Our Q&A is empty. The chat has been every question out there has been answered. So if we sometimes have a shorter call, let's just be grateful for the time we get back. Meryl, did you have something to add? Or you looked like you wanted to say something. Okay.
Yep.
Okay. Reminder to everyone that we will, next week, we're going to have the Office of Early Childhood on for a listening session on the portal. So mark your calendars for that. And then the week after that, we're going to have a Care for Kids new policy manual and updates session. So a lot of important stuff coming up. Every year we can't decide what to do for that week of Thanksgiving, but I'm guessing we'll probably take it off. If we kind of always leave it, and if there's something major we need to discuss, we'll use it, but we'll just kind of hold it and we'll figure out, you know, kind of how hectic everyone is. So we've got a couple of good things coming up the next 2 Mondays, and yeah, so mark your calendars. That's it. I am, let's see, I guess all I want to say is thanks to everyone for being here, Lucille for giving us, opening this up to so many more people. And, you know, this is a hectic time. We're now, you know, everything feels very insecure. And so I'm sure you all are feeling stressed out about lots of things. Hopefully these calls bring you a little certainty in an unfamiliar place, and at least we can get your questions answered. So if you have any topics or questions that you need answered, that you want us to be addressing, you can always email us. We've got info@Early Care Connection, kind of goes to a big main mailbox, but I think everyone here probably can very easily find any of our email addresses as well. I'll put the information on how to subscribe again to the YouTube so you get notified when the recordings are posted. And obviously you can go to the website earlycareconnection.org to see the calendar, to share the link to join here, whatever else. So Meryl, before we close.
Yes. Just a reminder that when LISC was on a couple of weeks ago, they were not able to share their survey link about future construction projects. I, of course, have not been able to find it in the last minute, but I will share it on the EC listserv. The idea here is if you have a project in the works, and that could range from, I'm ready to put the shovel in the ground right now, but it would be really nice to have some grant funding to help pay for it, to all the way to the other end of, I'm thinking about this and I'm trying to figure out whether it's feasible. You should fill out the survey to give them that information so they can figure out what sort of technical assistance you might need, as well as whether or not you're a likely candidate for the money that they've got to distribute right away. So take a look in the listserv and the EC info listserv, and I will share that as quickly as I can. Let's see, and LISC is having office hours today at 1 o'clock if you have questions.
Yeah, and there is. Yep.
Meryl, can you give instructions for those who are not on the listserv, how to be on the listserv?
Oh, I have the
will-
link actually right here, but go ahead and talk.
Okay, so Izzy's going to stick a link in there. You just click the link, put in your email address, and say subscribe. It's really easy. And I think there's an option if you want to get them as a digest as opposed to whenever they come in, but you can see that pretty easily on that link.
Yeah, and then there's a question here from the community, from Jen. Does anyone know where I can find the recording from the 10/22 OEC provider meeting? So if anybody knows that, if you could stick that link in the chat or give her some breadcrumbs on how to find it, that would be very helpful. All right, we'll leave that open just for a minute in case anybody has that information, but oh, Q&A. Okay. Isn't the LISC grant only for expansion, not renovation or health and safety?
You should do the survey either way, because they need to know what kinds of projects people are looking at. They have the money they've got to distribute in the next couple of months is pretty limited in what they can do with it, but there is bonding money, $80 million worth of bonding money to be used over the next 7 years that may be a little bit more flexible. So just let them know.
Liz also said in the last call when she was on that by doing and filling out their paperwork, even though you think you don't qualify this time around, it gives them a heads up that, you know, to walk you through the steps in preparation in order to potentially be ready for the next round as well.
Yeah, and somebody also, Linda says, if the renovation results in expansion, it could also be eligible. Mary Baez, I am thinking you put your email in there because you want to be on the listserv, but you have to add yourself to it if that's what your email is in there for. So I've put just instructions and the link for you to click to do that. I'm guessing nobody knows where that 1022 provider meeting is. Sorry about that, Jen. But I think that would be something that you could put out on the listserv actually, and you may get an answer there. Okay, now we're really done. Thanks everyone. Have a wonderful week and we'll see you next week.